Welcome. Today we shall be looking at continuous positive airway pressure or CPAP. CPAP is a crucial non-invasive respiratory support technique that is widely used in neonatal, pediatric, and adult care settings. By the end of this tutorial, you will understand its physiological basis, the clinical application, setup, and potential complications of CPAP. CPAP is a non-invasive ventilation method that supports spontaneous breathing. It is commonly used in patients with moderate to severe obstructive sleep apnea, especially in outpatient and home settings, as well as in the neonatology unit or pediatrics unit. The CPAP works by maintaining a constant level of positive airway pressure throughout the respiratory cycle, preventing airway collapse and improving oxygenation. Physiologically, CPAP maintains the patency of the small airways and the alveoli by providing a continuous pressure which prevents alveolar collapse. This increases the functional residual capacity of the lungs, promotes uniform lung inflation, and enhances gaseous exchange. It also reduces the work of breathing and improves the effectiveness of bronchodilator delivery. Additionally, it helps to move extracellular fluid and stenting the fluid-compromised airways open. A CPAP machine consists of several essential components, which include a flow generator, a humidifier, nasal prongs or a mask, circuit tubing, pressure manometer, and a bubble chamber in bubble CPAP. Each component plays a vital role in ensuring effective and safe CPAP therapy, from maintaining the airway pressure to improving patient comfort. There are three types of CPAP masks, which include the nasal pillow mask, the nasal mask or a nasal continuous positive airway pressure mask, and then a full face mask. In a nasal pillow mask, a small mask sits over the nostrils or a nasal prongs that sit directly inside the nostrils. It is suitable for clients who feel claustrophobic wearing bigger masks, clients who want a full field of vision, and clients who wear glasses, as well as clients with facial hair. The second type of CPAP mask is a nasal mask or a nasal continuous positive airway pressure mask. This mask covers the nose only and is the most common CPAP interface. It is suitable for clients who have been prescribed high pressure setting and clients who move around in their sleep. And lastly, we have a full face mask, which fits over the nose and the mouth, and it's suitable for clients who have difficulty in breathing through the nose due to a nasal obstruction or congestion. As well, it can be used in clients who breathe through the mouth at night. A proper selection of a mask is key to a therapy adherence. Moving to CPAP settings, the initial CPAP setting typically include a pressure of between 5 to 6 centimeters of water, a flow rate of 5 to 10 liters per minute, an FiO2 that is adjusted to maintain the SpO2 between 90 to 95%, and when setting a CPAP machine, humidification is added to prevent mucosal dryness and increase patient comfort. These parameters are tailored to patient condition and response, as well as to your institutional policy. The CPAP is indicated in several conditions, which include respiratory distress syndrome or RDS, transient tachypnea of the newborn, apnea of prematurity in newborns, meconium aspiration syndrome, a post-extubation support in weaning from a mechanical ventilation. It can as well be used in atelectasis and mild pneumonias, obstructive sleep apnea, acute respiratory failure. It can be used as an alternative to mechanical ventilation, and sometimes it is applied in left ventricular failure patients. Some of the contraindications in the use of CPAP are patients who are apneic, gasping, or those who have a birth weight under 1,000 grams without expert care. Other contraindications will include severe cardiovascular instability, congenital anomalies, for example, choanal atresia and tracheoesophageal fistulas. It is contraindicated in patients who are not breathing on their own or those who are unconscious, in clients who are uncooperative or severely anxious, and should not be used in clients with a GCS score below 8. It is contraindicated in clients with facial trauma or burns, clients who have undergone facial or esophageal or gastric surgeries, those clients with air leak syndrome, for example, the patients with pneumothorax with bronchopleural fistula, those with excessive respiratory secretions, severe nausea and vomiting, and clients with severe trapping diseases with hypercapnia, for example, asthma or chronic obstructive pulmonary disease. To initiate CPAP, patients should weigh at least 1,000 grams and have a 5-minute Apgar score of 4 or more, then a Silverman-Anderson score of 4 or greater, and an evidence of moderate to severe respiratory distress support that needs CPAP. And importantly, there should be no any contraindicating congenital anomalies. How do we set up and use a CPAP machine? Setting up a CPAP machine begins with by placing the machine on a stable surface near the bed and a power outlet. Then we check and install a filter. Attach the hose to the machine using special connectors. Then plug the hose to the mask, as this mask should fit securely and snugly on the patient's face. Then set and activate the correct pressure settings. Attach the humidifier, which needs to be filled with distilled water up to the maximum level. Then plug the CPAP machine into the power outlet. Put the mask over the patient's face. Attach and pull the straps to secure it into place. And remember, this should create a seal without pinching the skin. You need to turn the device after setting the correct pressure settings, and you need to ensure a proper seal to prevent an air leak, enhancing therapeutic effect. Like any interventions, CPAP has potential complications. The complications related to CPAP use include a nasal trauma, abdominal distension, pneumothorax, hypercapnia or hypoxia, and mucosal drying. Patients may also experience congestion, sore throat, dry mouth, hypotension, dry cornea, and barotraumas, respiratory infections, excessive dreaming initially, and nosebleeds. Awareness of these complications is essential for early detection and management.